Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm still talking about restoring lost teeth with your back teeth. You pull them up from the back and fill in the places. There are a lot of situations where young people get their 6-year molars before they're really able to take care of them, and a lot of people lose their 6-year molars. And if you get a hold of this later on, say when they're up and their second molars are back there and the wisdom teeth are on the way, you can pull the back teeth forward and fill those gaps where people have lost their 6-year molars earlier on down there. And that's kind of the case we're going to show you here again. I've shown it in other ways, but we're talking about getting a section of restoring dental problems with teeth you have, rather than throwing away the wisdom teeth and putting implants or bridges in here. Pull the teeth forward and bring them in place like that. So I hope this is going to just give you another example of that. Let's get going on in here, and it kind of takes a while to show this. These are pictures that came that we got back there, just printed out on paper. They're not really good, but they've closed all these spaces up. It's completely done. Now here it was, that was finished, and here we have this spring we developed to close a gap like that. And what, if you aren't familiar with closing them, you come along like this and you make a deal this way, and then you come off and you raise that up and hook it into a tooth, and you pull from the end here, you tie this tooth and pull it, and this will move the tooth bodily. It'll bring it up, it'll come right up in here. And if you're pulling too hard on it, it'll pull the crown over here and the root won't come in. If you give it enough of this down pull, the root will come right on over and join that tooth right there. And I think that here the tooth is. And this is for the first comes, it looks like it's got bone gone there, but you leave it alone and it'll fill in like these places have all been, they filled in around the bone after a certain length of time. When you're moving one, the periodontal membrane in there gets thick looking like that. All right, let's get on with this. Now here, this is backing up on the x-rays. Now here we started out with this case like this, and these teeth were bad. Now the person lost a 6-year molar here when they were real young, and these drifted on their own like that and came up there. Then once you get older, they won't lay over this way. You can do it when they're real young. Now this tooth, we want to carry it up there, and that's usually one you've seen back here. Now let me show you a little trick. Like if you, let me get one back further. Let's see, no. All right, this picture right here, see this tooth was hung right here. It couldn't drift up here. There's a little trick to picking that tooth up. Tilt this tooth over a little bit, just angle it like this, and the back end of it will go up. It'll come up rather than this going down, and it'll pull that space in there. And if you go with it like this, let's see. Now that's up a little bit. Up, sorry. I lost it here. All right, there we go. Now I picked that tooth up, and now that tooth slid right underneath here, and now you can take this whole thing and move them together and move it up in that space these things here. Now on this particular side, we didn't want these teeth to go back, and so you put a tad in here. Well, they asked for a tad, they gave me a great big old one, and it looks like it's too big, but I screwed it in there and bonded it to the teeth right there in front, and this stayed where it was, and these came forward. And if you want to pull the back teeth forward, you tad up in here, and then you close, and these will stay there. Over here we didn't mind, so we pulled each other together and just closed the space. It's coming in from both sides. Now we put that tad in there. It looked like you could put it through a 2x4 or something. Anyway, I bonded it, but it's out to the side, and you can see that. And we brought it up and got it up, and when that bumped into that tad, we pulled the rest of it with a class 2 elastic, brought it in. And that's 10, that's the date it is. And here we are finishing this case out. And we got little brackets over there. We're closing the space. I'm going to run through this real fast. I'm not trying to cover all the problems and things. I've got a narrow bracket here that works good, and you can use those, or you can use the little tiny ones that we've had. Anyway, here is the tad, see, and it was a big old thing, and it bonded it onto the teeth. You could put one tad over here and one over here and wire between them down low where you could bring it all the way up if you want to. That keeps these teeth here. These will move and those won't. Over here we pull this back and this forward at the same time, and that's where we got them in. And that's the bottom part. And this is 010. Here we finished it out. But what I'm trying to get across is that you can restore your teeth with your teeth if you've got the extra teeth back there. So don't throw the wisdom teeth away unless they're giving you some trouble. I mean, if they're getting abscessed or getting something caught around them or they're bad, okay. But the wisdom tooth is in the best place in the mouth for chewing. The muscles go right above the wisdom tooth and the second molar back here. If you want to bite something hard, you put it back there. It's much better than trying to fit it in the front. You got to have, you slide your jaw forward. You got the condyle is up here on the eminence, and it puts a strain on it too when you bite with your front teeth. If you want to bite something hard off, put it back here and bite with the thing in that position. The wisdom tooth is the best chewing tooth in your mouth. You put more force on it. Okay, let's see. Here we've put a little lacing in here to pull the front teeth together. And then this is just a lot of just regular dentistry, which I'm not trying to show in this particular thing. But we close this space up where the bad 6-year molars were taken out. Just make darn sure you got the good wisdom teeth when you do that. Don't pull these teeth until you do it, because you may have to keep the second molar and bridge it, or you have to put an implant in there, or if you pull it up, you still have to put the implant. So you might as well just leave it where it is and put the implant in that area. And that's what a lot of people do. They put the implants here and then extract the wisdom teeth and pay a big fee to get the impacted wisdom teeth removed, and then another big fee to put the teeth in here, when you could just take the wisdom teeth and bring them up like this. And that's what I want to get across to people. And they ought to teach this in dental schools, regardless whether they want to do it or not, so they know it can be done, and give a person a choice to do that, rather than do the implants and everything else. And this is what I want to get across. There should be another section of orthodontics in restorative dentistry through orthodontics. And it's mixed up. I've got several cases that got a lot of teeth out. And we had to get the teeth they had left and put them where they should be, and then they had to bridge all these places. But you had to line them up orthodontically before you could bridge them. So I'm going to hush, and I hope this gets across to people wherever you see it. You can do this, and I don't care how old you are. It can be done at any time during your life, as long as you're alive and you got some bone there for the teeth roots to be in. And that's a fact. Now, you saw that bone structure. Look at it over here. There's a little problem right in there, but that's not much. And I don't know what that is. And here, the finishing of the case, I wanted to keep the arm or the retainer on the teeth, so we put some composite there. And now that retainer wire will stay right down on here, and she'll wear that for a good while until that teeth get settled in and how far the tongue pushes. Now you've got to get back to some point in here where the pressure of the tongue is equal to the pressure of the lips, or where you pull back and the teeth fit between the two. That's where they're going to eventually try to go to that. And that's how long you wear a retainer. You keep it, and you wear it just a little bit. If this drips out till the tongue pressure and the lip and cheek pressure are the same, and then the teeth stay there. And when we do these serial extraction things, they come in there, and you do that reduction of this. That's where the teeth erupt in there. That is the place where they ought to be, and you can't tell exactly where you ought to put them on the cephalometric x-rays or anything else. So I'm going to hush and thank you for watching. I hope you'll pass this on to your fellow dentists and wherever you live. Bye-bye.